For this mental health podcast, we're talking about a very sensitive subject for women. Having a baby, I can tell you from personal experience, is a very exciting and special time. But for some women, it can be difficult. They can have this thing called baby blues for a couple of weeks after giving birth. And for some women, depression and anxiety continue on for weeks. I'm talking about postpartum. So we're going to talk with a local doctor about what it means, what's the definition of postpartum, how you can get through it if you're a mom who just gave birth, and what you can do if you're the loved one of a new mom to help mom get through that time and still be supportive of her baby.
Most women, 2 weeks, most women during those 2 weeks post delivery have what we call the baby blues. So it's very common to experience some anxiety and some depressed mood because there's a cascade of events that are happening to them physically and hormonal changes, and their life has turned completely upside down. So, but we expect that there's going to be about a 2 week adjustment for them to kind of bounce back and get into the groove. But for 1 in 7 women, those baby blues don't end and in fact get worse. And they can present with more severe depressed mood, to have a mixture of anxiety and worry. Sometimes they feel like they can't connect or be attached to the child. What can complicate things if they're getting depressed and they're getting anxious, they're having trouble with breastfeeding too, and bonding with the child then. And then that really exacerbates the problem. And then the other issue is that there still is a lot of stigma about reporting that you're having postpartum depression or you're having trouble after childbirth. So we think about half the women that do have postpartum depression never even report it.
And why is it that they don't report it? I would think, because I gave birth last year, I would think that someone would say, oh, well, it's such a huge transition. We would kind of anticipate something like this happening. So why is there a stigma?
I think part of it is there's people put a lot of pressure on themselves. They expect that it's going to be a very joyful occasion, and they don't anticipate the physical changes that happen to them, as well as the challenge. It becomes a logistical challenge. And then also, sometimes your feelings and are not in your control, and they feel shameful too, because they're not meeting the standard, right? So they're almost embarrassed to tell somebody that they're struggling. And then, we hear stories of, these horror stories of people with postpartum depression. And I think young mothers are worried about reporting that because they don't want to be judged by other people or have the child taken away.
What are some of the signs and symptoms of the postpartum depression? I'll ask you that first.
Signs and symptoms would be, so this would be, so it is common again to have baby blues for 2 weeks after birth, but this would be where you start feeling like you can't get connected to your child. You are crying multiple times throughout the day. You're feeling immense sadness, feeling like nothing gives you pleasure. You're not wanting to eat, not wanting to sleep, or you're wanting to sleep all the time, and you're feeling very fatigued. And sometimes this can be mixed with anxiety, where you're even worried about being around people. And then on the severe end with postpartum depression, sometimes you can have postpartum psychosis as part of that depressive presentation. So where you will get paranoid and potentially hallucinate, but it's very rare, but that can happen too at times.
So then there's also this thing called postpartum anxiety. I did not know about this. Talk about what that is.
Sure. So anxiety is really the most common mental health condition. So, it affects about 20% of women anyway, about 10% of men. But it is related to depression. So often when somebody has depression, they also have some anxiety symptoms, but for some people, those anxious symptoms become primary. So where they're, worrying about the child, worrying about themselves, afraid to go outside, afraid to see people, and they're just living in their thoughts and having fearful anticipation.
The fearful anticipation, thinking within the framework of being a mom, I would assume it's things like, oh, is the baby breathing? Did I feed the baby enough?
It can almost turn into an OCD, an obsessive compulsive type
Uh-huh.
presentation where, yes, they're having trouble being apart from the child. They're envisioning in their mind while the baby's in the crib that the child is not breathing. It's getting smothered by, their blankets, or the cat is in the cradle, so to speak. And it's really hard for them to focus and get some rest and get into self-care.
Whether a mom has a supportive group of people or not, how does a new mom get through something like this?
So, I mean, you bring up a great point though, too, because postpartum depression can be related to a lack of support. So it's more common in single mothers than in mothers who have lots of support. So if you are a single mother or somebody that just doesn't have adequate support, it's important to plan ahead, to make sure you have the resources that you need. And then also, this is messages for people that know someone that is giving birth and that know somebody that may not have a partner or have a family nearby, just to make sure you reach out to them and give them that extra nudge or the reminder that you're here for them.
How does someone typically find a resource to get through the transition of being a new mom when it comes to their mental health? Do they go back to their OB or?
Usually, you're getting a referral from your OB, because OBs are a great resource. They also screen new moms to make sure they're doing okay, and if they're not, they send them to an appropriate resource like a psychologist, a therapist, or even a psychiatrist if they need medication, if their condition is severe. So, but there are all levels. So sometimes, again, those baby blues just extend and you may be struggling a little bit and need to talk to somebody and work through it. And then on the more severe end, sometimes you need medication to help reset yourself.
And so this is something that comes to mind. Is there anything a mom can do before she gets pregnant to know what to anticipate as far as postpartum? Is there any screening test or anything like that?
If you have a history already of anxiety or depression, you are more susceptible to experience postpartum depression. So I would certainly be communicating with your healthcare providers beforehand, and what resources you need or they may anticipate that you need, as well as letting your family and friends to know, like, it doesn't matter what you say, please check, it doesn't matter what I say, please check in on me and make sure that I'm okay and spend time with me. And then it's important too that new moms are taking care of themselves, right? And they're eating and they're trying to get as much sleep as possible. And dads and partners need to really step up to the plate too, and make sure they do their part, because it's very common for a new mother to want to push a partner away and focus on caring for that child. And this is like, I mean, this can present a whole other host of issues, because that couple's relationship changes as there's a new person.
Yeah, new
um,
dynamic, right?
that's right, absolutely. So it's really got to be a joining of three people. It's not just mom and baby anymore. It's got to be the three.
Got it. Any other takeaways you think it's important for people to consider when it comes to women and postpartum?
Yeah, so postpartum can begin before birth, and we call that perinatal depression or anxiety. If you are experiencing that even before birth or having some trouble, it's okay to reach out to your OB or to another professional or to a family member or friend, because often the trouble begins even before that postpartum period. So, it's never too early to reach out and get help.
Remember, no matter what you're going through, help is always available. I've posted links to some of the local resources that are available that you might need if you're going through postpartum.